Hi, welcome to Wellness Wednesday. I'm Dr. Jessica, the naturopathic doctor here at the Coach House, and today we are actually on site at St. Jacob's Midwife with my midwife, Gaby, and we're going to talk to her a little bit about how midwives work here in Ontario. Most of these questions, obviously, I don't know the answer to because I've had a midwife, but we're going to let Gaby explain. So, Gaby, tell us a little bit about midwifery here in Ontario, how you were trained, that kind of thing.
How we were trained. So midwifery actually in Ontario is the first province to get midwifery. So we've had it since '93. So we're getting to our 25th anniversary. And it is an undergrad program in Ontario. So unlike other places in the world where you have to be a nurse first, here it's a 4-year undergrad program. And what else was the question?
So you're regulated here in Ontario too?
Yes, we're regulated. So we're governed by the College of Midwives, just like other health professionals. And they're there to protect the public. They're there to tell me what I can do, what I can't do, and when I need to consult with a doctor. So yeah, it's regulated like other health professionals.
Because I remember when I was pregnant, you were saying, I talked about the business of being born, and you're like, they're not regulated in New York. It is not the same everywhere.
Right.
Da, 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 da. But here in Ontario, we are regulated.
Yes, yeah, very much so. It's a lot different in the States and in different states.
So if somebody wants to have a midwife, what do they do?
They just give us a call as soon as they are pregnant. You don't need a referral, and so sometimes people think that you need to get a referral from your family doctor. So it's best if you call right when you're pregnant, and we can take care of you right from the very beginning of your pregnancy.
And so when they have a midwife, they won't be with an OB.
Yeah, that's right. So we're meant to take care of low-risk, healthy people. So the expectation is that the pregnancy usually will stay healthy. So we should be able to do everything that is needed for a low-risk, healthy pregnancy: ultrasound, blood work, deliver the baby, take care of you and the baby afterwards. So you just give us a call and we can sort of take it from there.
So if it changes and they go from being low risk and then something comes up, it's not that they're not going to get an OB, it's that you can then also work with the OB.
Yeah, definitely. We're not interested in taking care of people who are out of our scope. It's not good for the woman and it's not good for us. So if there's sort of a long list of things that require me to consult with a doctor that might come up in the pregnancy or after, and so it might be something as simple as just getting an appointment with a doctor and getting an opinion, all the way to them taking over care until things become normal again. So it's in everybody's best interest if we get the doctor involved. So that's what can happen. And sometimes we do a shared care situation where the doctor says, well, I don't need to take over totally, and so we might go back and forth with the doctor, and sometimes things resolve. You know, somebody might be at risk for preterm labor, and then all of a sudden we pass the risk point and we take over again. So actually we work really well with the docs in this community. They're awesome, and because this is one of the first places that had midwives, there's a long history here, and so they're used to sort of working with us. So I think it's worked well with us.
And so on that note, a lot of people sometimes think that when you have a midwife, you have to have a home birth.
Yeah, that's a big myth, and I don't know why it keeps persisting, but I would say most people who come to have a midwife, they have a baby at the hospital. I would say, I think of the stats for this clinic, maybe like 10 to 12%, and so that means the vast majority of people choose to have a hospital birth. And I think that that's a remnant of the past. When we weren't regulated, if you had a midwife, you had to have a baby at the hospital, and that's still in, grandmas who are around, they knew midwives that way. So we're not that far removed from that history, and so people will think that that's the case still. But most people come to midwives not because they want a home birth, but it's because they want the kind of care that we provide. And so we're very comfortable in both locations, and whatever a person wants, there's no pressure either way. There's no preference on my part. It's wherever the person wants to be.
And so on that note, tell us a little bit about how care differs with you compared to going with like an obstetrician or a family doctor that might deliver.
So the hope is that the clinical care is the same. There should not be any difference between a doctor care and a midwife care. There is a best practice, and there's the best way to do things, and the hope is that that's what everybody does. But in terms of how we deliver it, I think that's a little bit different. Your first and last visit are an hour, which is quite a long time. So we have a long time to discuss what's going on, what tests are coming up, why we do the tests, what the results mean. If an ultrasound were to come back that wasn't quite perfect, we have time to discuss what it means, what the plan is. So, like I said, the first and last visit are an hour, and then every other visit after that is a half an hour. So that means there's lots of time for questions. Nobody should ever feel that we're getting up with our hand on our door until everything is discussed. And some people take that whole time every time, and other people come in and say, I don't have anything today, and that's fine. You don't have to entertain me. And so you can be in and out. And I think that's another benefit, is that we pretty much stay on time because we have such a long slot for people. So I think that part is different in terms of the long appointments and the feeling like you have all your questions answered, but you also have time to get a relationship with people. You have time to sort of talk about other things. And so, come the birth, you kind of know the person as well as, their clinical care, but also sort of who they are. So it's a little nicer relationship. And I think people appreciate that part. And then the other part that you get, and that's different, is the home visits after, which I think a lot of people really appreciate. For the first week after, we'll do home visits. Minimally, it'll be 3. There are people who get a visit every day if that's what's needed. I think the most important thing is that things stay on track. Lots of people are interested in breastfeeding and really keen to get that going. And so sometimes you need a whole bunch of visits just to make sure it stays on track. So I think lots of people appreciate that, especially in the winter. You don't have to pack up your 2-day-old baby and go for a weigh. So I think it's a bit of red carpet treatment.
It is red carpet treatment. It really is. And same thing. Like if you see anything and you need a referral, you can do that. Because I know, like my son was tongue tied, and you caught the tongue tie, and then we went for the referral and got it fixed, and then back at the clinic.
Yeah, we can do referrals. We mostly refer to OBs because that's what we're dealing with, but certainly referrals to like a physio for your baby, the tongue tie, lactation consultant for things that we're beyond our scope, that we want you to get the care that you need. So certainly we can make those referrals for babies or for moms.
And now, there have been some recent changes here at St. Jacobs, correct? Where before, if you needed Pitocin, epidural, there was a transfer of care, and now that's not the case.
Yeah, so every hospital in Ontario decides how they want to manage that. There's lots of hospitals where midwives have what we call full scope, where if somebody needs oxytocin, they need to be induced, or they needed or wanted an epidural, you didn't need to transfer care. So up until about a year ago at Grand River, that was the case for midwives. And so it was a little bit hard for people to lose their caregiver just for maybe wanting an epidural, which doesn't mean anything was wrong. And so as of last fall, you don't need to transfer care if it's just for an epidural for pain management. Of course, there might be other things that come up. We're still transferring care for people needing oxytocin to be induced, or other reason they might need that.
It's epidural that you
It's just epidurals that we cover. So I think it's worked really, really well. Yeah. It's nice because they get it in a more timely way.
Now, I think I covered all my questions. Is there anything else you want to add? I'm going to put you on the spot.
You didn't prepare me for that.
I think we hit it all right.
Yeah,
the way the care works, how to apply. It's true though. Like a big benefit, I think, is developing that relationship, because I know by the end of it, like you feel very comfortable. Like it was a great experience. As I refer to everybody I know here.
Yeah, it's an awesome job because everybody has babies, and so you meet all kinds of people, that you would never meet in your regular life.
And then we did the reunion, and that's how I cornered you into doing this video.
Very persuasive.
I know. Okay, so I want to say thank you for sitting down with us, and thanks to St. Jacobs for letting us be here. If you have any questions about midwifery, we'll link the website to this video, and then you can always contact St. Jacobs if you find out you are pregnant.
Or there's other clinics in town.
There are other clinics, yes. So there's Blue Heron, there's St. Jacobs, Blue Heron, KW, and Genesis, and then Cambridge.
Yeah.
So there are lots of clinics too. So thanks for being on, and we'll be back in 2 weeks.